sternoclavicular disc. So here see the beauty of the human body. Sternoclavicular disc, when we need a disc means, suppose if two articulating surface are articulated, if two articulating surfaces are articulated properly, so here there is no need of the articulating disc. Suppose if two articulating surfaces are, if two articulating surfaces are like this, okay, it is like this, the articulation between these two is less, and here still some part of the bone is remaining. So in these places we need articulating disc to increase the congruency of the articulating surfaces, so that if the articular surface is like one articular surface is like this, one more it is like this, there is no need of the articular disc. So here congruency, see the contact between these two bones is, it is more, so the stability will be maintained. Suppose if the congruence, suppose if the one bone is small, one bone is big, so that means here to maintain the congruency we need another additional support. Those additional supports are nothing but the disc. So here in our sternoclavicular joint we will be having the disc, it is going to increase the congruency, okay, it is going to increase the congruency, it will increase the congruency of the articulating surface. So superiorly the articular disc, here the red color one is articular disc, superiorly the articular disc is going to articulate to the superior portion of the medial head of clavicle. See here, this is the superior portion of this medial head of the clavicle. This is medial head of the clavicle. This is lateral head or end, medial end of the clavicle, lateral end of the clavicle. If you see, the superior portion is not going to articulate with the manubrium, so it will give connection to the superior portion of the medial end of the clavicle will give articulation to the articular disc, here sternoclavicular disc. And if we see inferiorly the disc which is going to articulate with the manubrium, and at the same time first costal cartilage. See, inferiorly it is going to connect to the manubrium. This is first the cartilage which is present here, that is first costal cartilage. So the disc is going to attach to the manubrium and first costal cartilage. Because of the presence of disc, here the disc is going to divide the sternoclavicular joint into two portions. It is going to divide the joint into two portions, so that here presence of disc, it is going to act as a hinge or pivot point during sternoclavicular joint movements. I'll explain this here. First we will take elevation, depression, okay. Second we will take protraction, retraction. If we see elevation, depression, we know already what is elevation, depression. We saw in the scapulothoracic joint. If the person is doing elevation and depression, here the clavicle, see this is clavicle, this is first rib. The clavicle will move to the elevation and at the same time depression. Elevation and depression movements will happen. Here the main point is articular disc, the disc which is present here, it will not move. And at the same time here manubrium is manubrium also stable. Here only the clavicle will move on the rest. The clavicle will move on the disc. So that here the disc is going to act as a pivot point for the elevation and depression. If we see protraction, retraction means this is protraction, this is retraction. That means protraction nothing but abduction, retraction nothing but adduction. Abduction is away from the body, adduction is towards the body movement. Suppose if the scapula is moving like so, this is protraction, this is retraction. Suppose if the clavicle is moving like, protraction means away from the body, retraction means towards the body. If this movement is happening, protraction, see protraction and retraction movement, here what will happen means the clavicle will move at the same time the disc which is present here, it will also move with the clavicle and disc together, it will move, protraction, retraction, so that here the manubrium will be stable. So that here the point is, when the protraction, retraction are happening, here the manubrium is going to act as the pivot point for the protraction, retraction movements. Here the disc and clavicle together, it will move. So this is the point. What is the use of this? Because of the presence of the disc here, it is going to helpful in the elevation, depression, at the same time protraction, retraction movement. So that the changing ability. What is this changing ability means? When the patient is doing elevation, depression, disc is not moving. When the patient is doing protraction, retraction, the disc is moving. That is nothing but the changing the ability. So that means it will shift the articular disc, the function will shift. If you do elevation, depression one time, disc will not move. If you do protraction, retraction, immediately after elevation, depression, disc will move. That means the disc, it is going to shifting to the work. So that is the changing ability. What is the use of this means? It is going to increase the mobility, the changing ability of the disc. It is going to increase the mobility of the sternoclavicular joint, at the same time increase the stability of the sternoclavicular joint. Second function of this sternoclavicular joint means sternoclavicular disc. So it is going to increase the congruency. Okay, it is going to increase the congruency. It is one function, and one more function. It is going to resist. Otherwise, it is going to accept. It is going to accept the forces which are coming from the lateral end of the clavicle. So this is the lateral end of the clavicle. Here we will be having humerus. Okay, this is our shoulder joint will form here. The forces which are coming from the lateral end of the clavicle, if somebody push or if we do like this, so the force which is coming from here lateral end to the medial end, from there here the disc will be present. No, the disc is going to take the forces which are coming from the lateral end of the clavicle. So this is about the sternoclavicular disc. Okay.